Hi friends, Dr. Tim Garcia here, and this topic is called the price of a fall. Most parents would love nothing more to have their child so protected in bubble wrap every time they go outside to play, but it's unrealistic. Some statistics regarding childhood injuries and related deaths are disheartening. According to the National Safety Council, unintentional injuries are the leading cause of death in children, with falls being the most common. The American Academy of Pediatrics states that 140 deaths and 3 million emergency room visits are due to fall-related injuries of children under the age of 15. Infant falls. You know, learning your baby can roll over is very exciting, but it depends on how you discover how the baby rolls over. Lots of times it's right off the couch or off the changing table. And unless the child cries for an extended period or shows signs of concussion, then it's considered a milestone in the child's developing life, and you comfort the child, you pick up the child, and then away you go, but that could actually leave the trauma to the spine undetected. Toddlers, when they're learning to walk, they have a low center of gravity, and it's very common that they fall, and lots of times they spend more time on their bottom than they do on their feet. And of course, not every fall will cause injury to the child's spine, but as they accumulate, you may have repetitive stress injuries that occur. The repetitive stress injuries can affect the sacrum, which is the base of the spine, or the tailbone. Now, if you have a misaligned sacrum, which is the foundation of the spine, and it's not corrected, then your spine may actually develop, will not grow straight, and this could be a cause for scoliosis, which a lot of medical practitioners really don't understand that what the cause of what they call idiopathic scoliosis could be from falls. So when the sacrum is misaligned, your child's spine will not grow straight. Childhood falls, you know, a lot of children are playing hard and they have a lot of fun doing things, but I think your adventurous preschooler talking about being near windows and going through a window, those are most dangerous and most fatal. You know, an open window or even going right through the window. So be very conscious of that when your child is near a window. In 2002, 113 children died from window falls. Pre-Adolescent Falls is the jungle gym and the playground equipment, the acrobatic pre-adolescent. So playground-related falls. The last decade is estimated that 150 children died, and 200,000 children were treated in hospitals for these playground-related falls. Off the swings, the monkey bars, the slides, the seesaws, and other things. So who's at risk? 55% are girls, 45% are boys. Children ages 5 through 9 are at the highest risk. So what we can do? Be vigilant, be very careful watching your kids. Accident-prone child, somebody who's prone to falls. Got to be a little more careful watching these children. The adventurous child that shows no fear, scary sometimes, I know, or the distracted child that doesn't pay attention to what they're doing. So we have to pay a little more attention to them and be sure to intervene in a dangerous situation. The clumsy child as well, accident prone, that stumbles and falls frequently. Playground safety, just make sure it's safe, take a good check, make sure that the ground has a good absorbent material on the surface, that the playground structures are not too high, and that they're separated by at least 9 feet apart. Check for dangerous hardware, S-hooks that are protruding or sharp edges. Make sure all the small spaces are open up, that the children will not get stuck, and look for tripping hazards and stumbling on rocks. And of course, supervision, got to keep an eye out all the time. Vulnerable children, got to keep an eye on them. and of course wellness chiropractic visits to make sure your child is growing properly, so they'll have a normal health and a normal growth pattern. Understand, children have a limited time to grow. They have a genetic potential that as adults we've already passed, and we already developed to our full genetic potential. But these children, when they have misalignments and falls and poor posture and things like this, their spine needs to be checked, because the nervous system goes right through the spine, and so you want to make sure that these children are growing properly, have their posture in the right alignment. So you have an opportunity to check that for your children here at my chiropractic center, and come and get checked. We're here to help make sure that everybody has, the family has good health, and that everybody has health and wellness from now and into the future.